Okay. Welcome and good afternoon. I'd like to welcome members to this afternoon's. Can you speak into your microphone? I'll just move slightly. Sorry about that. To this afternoon's meeting of the Rutland Health and Wellbeing Board, and to members of the public who are listening in via the Zoom webcast. We have another busy agenda for today's meeting. So firstly, practical matters. We're not expecting a test of the building's fire alarm this afternoon. So if the fire alarm does sound, could attendees please exit the building via the nearest exit? The rallying point is to the rear of the car park. I'd like to remind members of the board to please raise their hands if they wish to speak, and to ensure that the microphone is switched on when addressing an item for the benefit of the webcast and the recording, and muted when not. I'll refer to Jane from Democratic Services if I need to record a vote or for any procedural matters. Thank you. So moving first to apologies. Jane, have we received any apologies?
Thank you, Chair. Yes, we have received apologies from Mike Sands from Public Health.
Thank you. Item 2, the record of the meeting. This is to confirm the minutes of the Rutland Health and Wellbeing Board meeting on the 27th of June 2023 are an accurate record. Would anyone like any amendments made to the minutes? No? Okay. I'll propose the minutes. Can I have a seconder, please?
I can't second them. I wasn't here. Remember,
Oh,
I
you
was portfolio holder there.
Thank you, sorry. Thank you, Ms. Mitchell. And all those in favour, please raise their hand. Over here. Yeah.
Thank you, Chair. Minutes are confirmed.
Or anyone against? Nobody. Okay. And anyone wish to abstain?
I'll abstain because I say I wasn't here, so I can't vote.
Lovely. So thank you, Chair. The minutes are now. Oh, sorry. So that's it. So number 2, actions arising. We have 2 actions from the meeting held on the 24th of January. These are number 1, reference 3, action Mark Young to distribute the mental health pathways once they'd been approved. The Strategic Director for Adult Services and Health has requested the action be carried forward for the attention of Emma James Hollands, Head of Community Care Services, to be completed by the 18th of July.
That was completed by Emma Jane.
Thank you very much. And number 2, at reference 5, I can confirm that I have circulated the copy of the independent review undertaken by the Rutland Health and Social Care Policy Consortium regarding the ICB's implementation of the guidance to the Director of Public Health and the Chief Strategy Officer for LLR ICB. Item 4, declarations of interest. Do we have any interest to be declared this afternoon? No. Number 5, petitions, deputations and questions. Jane, have we received any petitions, deputations or questions?
None received, Chair.
Thank you, Jane. Number 6, questions with notice from members. Do we have any questions from with notice from members?
None received, Chair.
Thank you, Jane. Number 7, notices of motion from members. Do we have any notices with motion from members?
None received, Chair.
Thank you, Jane. Number 8, the Leicestershire and Rutland LLR Integrated Care System update. The Part A, Rutland Health Plan update. We now have 30 minutes for this item. So we now have a presentation from Deborah Mitchell, giving us an update on the Rutland Health Plan. Debs, over to you.
Thank you, Chair. And Jane's going to be sharing the slides. I'll apologise to start off with. There's a lot of information on these slides. The slide pack will be circulated with the minutes, and there will be some further work. I would like us to have some discussion, and I'm going to sort of put forward a number of points for discussion about how we take the health plan forward in Rutland. So just first of all, next slide, please. So some strategic context. We previously submitted the health plan to the Health and Wellbeing Board in July 2022. And that version of the plan was an iteration which came from the health actions out of the Health and Wellbeing Strategy action and action plan. There have been some further developments since then. So we've had the LLR 5-year forward view, which was presented at the last board. There's been the primary care strategy and some of the fuller actions. In the LLR 5-year forward view, you will remember that there were 9 transformation delivery themes. And what we've attempted to do is to map the plan going forward against those 9 areas. Rutland's the first to do that across LLR. So this is work in progress, and we need to be cognizant of that and work with it. It will be an iterative process that we will need to develop. Should support ways of working with Rutland. Includes actions that we've progressed from 22-23, and they'll be referenced there. New actions will be in black text on in the plan, and evolved actions or actions that are still continuing will be in purple bold text, just for clarity. Next slide, please. So I just wanted to spend a couple of minutes talking through some of the challenges that we have at place in Rutland in terms of context. And when we talk through the plan, it would be really good to think these things through. So first of all, we've got rural areas bordering the ICB. A larger proportion of Rutland residents go outside of LLR for their care than come inside, despite the primary care being largely within LLR. There's a local development plan will provide better idea of housing growth when that is produced, and we will need to take account of that in our plans as they go forward. Alignment to local plans for levelling up and transport developments, again, and I will touch on the issue of rurality and deprivation in terms of access to services later on in the plan. Primary care workforce and infrastructure in support of the context of rurality, lack of national capital funding. Partnerships are quite unique in LLR because in most ICBs, you have more than one acute provider and sometimes more than one mental health provider, but in LLR, we have single providers of both acute and mental health. And then in relation to that, obviously, as I mentioned earlier, a lot of our population will go outside of LLR to Peterborough, Stamford, Kettering, Lincolnshire and other places for treatment. And so we need to do some alignment across borders. And then the last point on that slide, sustainability of local armed forces op community pilot is currently reliant on national programme funding. We've started this piece of work. It's not a specific Rutland piece of work, but obviously it has a big context for the Rutland population. The early indications from that pilot, some really good work, and we'll want to be able to sustain that going forward. Next slide, please. So these are the 9 areas of in the 5-year forward view there that are priorities, and I'm going to touch on a couple of issues in each of these areas as part of the plan. The slides are quite busy. I'm not going to go through all of them, but there'll be the opportunity when they're circulated for the minutes for you to peruse them. And I suggest that any questions that come from detailed questions that come from the slides afterwards can come back to myself and we can attempt to answer them, or we could have a further update at a future Health and Wellbeing Board. So next slide, please. So the first one's on preventing illness. You've got each slide. Could you move the picture so that people could see? We've got a pledge for each slide. Sorry, apologies for people in the room. So the pledge on preventing illness is spend more money on preventing people becoming ill in the first place. On the left-hand side of the slide, you've got some of the work that we've done to date. And on the right-hand side are some actions for 23 to 25. Now, although the 5-year forward view is obviously 5 years, you can't do an action plan for the full 5 years because things move on quite significantly. So what we've tried to do is pull out some key elements, some of which will be LLR wide, and some will have a specific focus on Rutland, because those are the things that we will have pulled out. So on that slide, you can see on the left, we've had increased blood pressure monitors available for hypertensive patients. Full allocation has been rolled out, and there are a number of other achievements there in terms of 3-tier weight management pilot program being commissioned. In terms of plans going forward, our actions will cover areas significant for Rutland, and those are on diabetes, hypertension, lipid pathways, weight management, smoking cessation, and armed forces support services. It's interesting that Rutland have one of the highest levels in LLR for hypertension, but that's because our detection rates are really good. So although the incidence is high, generally the population are quite good at coming to primary care for detection, and therefore we are pursuing their healthcare with them. So rates are not always a good indication of underlying health comparative to other areas. It means that we've detected them and we're starting to work with those. Next slide, please. This is a continuation of the preventing illness. And I've actually covered that next point. So again, these are some of the pilot works. For all of the slides, we've got to do some further work in terms of baselining and identifying actions, specific actions that are measurable so that we can work through. Next slide, please. So on this next area, our pledge for keeping people well, to identify the frailest in our communities and wrap care around and support them. There are a number of things that you can see that we've already done that were part of our health plan. So we've recently, our PCN and had the general practice veterans reaccreditation in Rutland, and that's really good. Across LLR, there's about 20% of our practices are accredited for veterans, but all of the practices in Rutland are. There's been the pilot was pilot, and you'll have to forgive the spelling mistake I've just noticed on that slide, which is the telemedicine in local care homes, and we heard about that at our last board. The last point is quite interesting on that side. So emergency admissions from Rutland care homes, if you compare the April to July from last year to this year, emergency admissions have reduced from 110 down to 50. Now, it's quite difficult when denominators are quite small, but that we believe is a significant impact, positive impact of some of the work that is an outcome of the WASAM pilot. In terms of actions, then we are looking to increase referrals to local pharmacies. If we can increase use of local pharmacies, it means we free up GP appointments for the patients who need to see a GP as opposed to needing to see a pharmacist or gain other help. And we're going to continue the development of integrated teams. Next slide, please. We're also going to be doing some further work on our anticipatory care pilot on dementia, and I think you're going to hear more about that in the next Health and Wellbeing Board. It was a presentation we were thinking of bringing here, but because the agenda was quite big, we'll work that through. dementia was a key area that we identified because there were low detection rates within Rutland. And, you know, we've done some positive work already, but that will continue. Next slide, please. So if we go on to equitable access for right care at the right time, there are 3 pledges here. One for improving access to GPs, one for reducing category 2 emergency calls for stroke patients, ambulance response times, and the third one to reduce and maintain waiting times in A&E departments. But the latter 2, or the last one, is obviously an LLR-wide position, but there's also links to some of the providers out of area. So the second one, I'm waiting for some information from EMAS around Rutland specifically. I was hoping to have had that before the board today, but I haven't, because the waiting times for category 2s are longer in Rutland than they are in comparison to some rural areas, not significantly, but it is something that we need to address. In terms of our work on here, I mean, we've done some work, a lot of work with PCN and primary care, as you can see on the left-hand side. We introduced the enhanced access service last October, and that's been running for a year with additional appointments in the evening, Monday to Friday, and Saturday services. We implemented cloud-based telephony for GP practices, Aging Well, crisis response and 7-day therapy. And we secured funding for the Op Community pilot, as I mentioned before, for armed forces. We will be reviewing the same-day access over the next 18 months, and that's looking at the MIU and the UCC, so the Urgent Care Centre and the Minor Injuries Unit, that both take place in Rutland Memorial, and looking to see if we can develop a new model of care which has less confusion for the patients and has a more straightforward pathway. So, and watch that space is going to be a big project, and we've already started some of the background information collecting and data, and we've had a couple of meetings, and there will be project meetings set up across the next 12 months. Unscheduled Care Coordination Hub, again, is an LLR wide project. It's actually won some awards recently, and that's where a multidisciplinary team are available to take calls from EMAS or other care coordinators for patients who look as if they might need to go into hospital or seen by the ambulance service, with an opportunity to look at, can we put some local care in place to prevent that admission? So there's going to be an expansion of that enabled by the WASAM pilot in care homes. And Clinical Treatment Centre. We have done a business case already to look at doing a clean room locally within Rutland to bring some care closer to home, and there's further work will happen on that, and we intend to roll that out. Again, it'll be in the next 2 years, dependent on any capital that we need and business case approval. Next slide, please. So this one, I'm not going to go into any detail about this, but you'll see on the left-hand side, there's a capacity and access and improvement plan that all primary care organisations, all GPs have had to produce. The PCN has produced that plan, and on the right-hand side are all of the actions that are identified as part of that. It's the process is to look specifically at demand, experience of access, and addressing the 8 a.m. morning rush. So primary care is quite interested in Rutland because I know it's heavy on the agenda of the local population, but we have a local guide which is based on some national data about the number of appointments, GP appointments per 1,000 population per week that practices should do, and it's the target is about 75 in Rutland. Your local primary care deliver about 120 appointments. They're about the top end of LLR. Now, whilst that's good news, and I think it's really good service that the primary care deliver, we recognise that for a rural area, access to primary care is probably more significant because you have less options of places to go. So we're not sitting back on our laurels with that. And some of the experience of getting through to a GP appointment, as we've talked through before, has been part of the debate. And so you'll see a callback. One of the actions is all practices to have telephony that includes callback capability. And there's some actions on there around improvements to the website, etc. Move on. So how am I doing for time? I'll speed up. I'll speed up, sorry. I did say there was too much in here. So health and wellbeing hubs. I'm not going to say much on this other than we've got a pledge to provide more joined up, holistic and patient-centered care delivered closer to home. So we're doing in the process of doing a broader estate strategy across LLR, working very closely with the council. Associated to that is a workforce and capacity and skills review. And we've got a working group set up jointly with the council. In fact, Kim and I came from that just before this meeting to look at opportunities of creating a local health and care hub. That's an LLR-wide priority, and we're probably a bit further advanced, even though we've still got a long way to go in Rutland than elsewhere. So next slide, please. So elective care. Our pledge is to reduce waiting times for consultant-led hospital treatment. We've done a number of things, talked about the clean room earlier on. We've done a business case. We've identified the types of procedures that we could do more locally. We now need to obviously follow through the full business case, get the location finalised and work that through. We'll continue in GP diagnostics at Empingham. Again, Rutland have been very fortunate that we've had local GP access diagnostics for the last 12 months. It was introduced across LLR only for winter as part of the 12 days of winter, and we managed to continue it in Rutland again in linking to some of the local need. And now we've had some national funding for that to move forward. We have to be able to make it mainstream, and we will need to await for national guidance on how that funding is going to link forward after this next financial year. We also would like looking at bringing macular degeneration injections more locally. So that's the AMD linked to the clean room facility. Next slide, please. I'm not going to say anything more about mental health other than two things. One, there's a presentation later, so you're going to get some more details there. Some really good work happened in mental health in Rutland, and I'm sure a lot of these are going to come out later. But I would like to say one thing. It's World Mental Health Day today, and part of the pledge of World Mental Health Day is to ask people, how are you? But to ask, how are you more than once. So you'll have seen around LLR that there's been some excellent work that the LPT and colleagues in the ICB have done about promoting World Mental Health Day. So just encourage people to follow through on that, asking colleagues, how are they? And asking twice, because sometimes asking the first time, you get a very natural, a very obvious answer. A second question sometimes opens up some of that support. Next slide, please. So actually, can go on to the one after that. Learning disabilities. Pledge increase the percentage of people on GP learning disability registers who receive an annual health check and health action plan. So there are 149 eligible residents in Rutland for this. There is work to do. Again, some really good work on LD. I'm not certain whether this is going to be picked up in the next section, in the presentation later on, discussion paper later on. But I'm going to move us on given time. But again, some really good work, and David might want to come and say some things afterwards. Women's health and maternity. So this is a new strategic priority. We will engage and listen to and empower co-produce services for women and girls. Part of that is trying to develop a women's health hub. There's some pilot money available across LLR, and one of the areas of implementation is likely to be Rutland and Melton. I was hoping to have had the final confirmation of that before the meeting, but I haven't, but watch this space. The other point I would say that there's been a lot of obviously growing publicity and talk about women's health priorities specifically. We need to do a bit more work on what the local position in Rutland is. So again, this will be an iterative process. Next slide, please. Children's and young people. Our pledge is to improve access to and experience of outcomes for children and young people, with a special focus on driving up health equity. Rutland has a small number of children compared to the overall position LLR wide, but what I would say about this area, we've got to do more work in health around children's services overall as an ICB, and are doing with one of our priorities. And then we need to link that down, obviously, to Rutland. We've obviously got the portfolio holders for children services year. I think the council do some really good work. I think health have got a bit of catch up on that. Next slide, please. So how the Rutland Place healthcare plan supports the local demographics. So there's a lot of information in those slides, and it covers health across the full priorities. We can't monitor everything as a health and wellbeing board locally. What we need to do is pick out some of the key areas for Rutland that you want to take some specific information and impetus to, and that's something that I think we need to develop as part of our committees. All of those priorities and the action plans will happen across LLR, so they will have a positive influence and impact on Rutland. But I think locally we need to focus on some of the things that are most important to Rutland residents. If you go to the next slide, please. So I've picked out 3 areas, and some of these boxes pull out some of those priorities from the slides. So in terms of older people's health, so Rutland has a higher than England average of over 60s. 33% of the Rutland population are over 60, and there's a projected growth of about 5,000 residents by 2043, and we've had some really good public health data and information on this. So our focus on health and social care, but this is the health plan, so I'll concentrate on the health element, so needs to be around how we look after our older population. So the content of those boxes are in the plans, but they're some of the areas I think we would want to pull out specifically as part of the Rutland Health Plan. If you go on to the next, I suppose the part of that I need to raise is that we need to aim to bring the right mix of care as close to home and help patients and residents get the best health in their own home as we can. So the next area is around deprivation. So nobody really thinks of Rutland in terms of deprivation, but we heard when we looked at the overall health needs analysis that there are pockets of deprivation within Rutland. But overall, there's deprivation in relation to housing and access to services because of rurality, sparsity of acute services nearby. And if you look at that deprivation in relation to access to services and housing, around 10,000 of the residents fall into that category, which is 20% of the most deprived category according to those areas. We're not talking specifically about economic deprivation, we're talking about access to services and housing. So these boxes look specifically at us driving care closer to home as a priority because of that local services. And again, these are actions that are in part of the overall action plan. Next slide, please. Armed Forces community. So I've talked about this a bit. If you look at the Armed Forces community, approximately 20% of Rutland population are associated in one way to the armed forces, whether that's regular or civilian soldiers. So 2,110 are roughly the latest data in terms of those numbers. 1,870 family associated, so children, spouses, etc., and 2,832 veterans. That's likely, so that comes up to about 17%, but it's likely to be an underestimation because not everybody will declare themselves as a veteran. So those are only the numbers that we know because they are registered. I talked about the op community, which is, I think we previously called it the single point of contact, that we are one of the pilots, and you can see on the map there, we're nicely in the middle. We're one of pilots across the country that have got some funding to set up a single point of contact for armed forces family to try and deal with some of the inequalities and difficulties that our armed forces population has. LPT are running this service for us and they've got some really good dedicated resource who are committed to the forces family, and we've done a number of things locally. Again, we had a really good support from public health in trying to get to the health needs. We've done some work with an engagement with Kendry Barracks. We're very fortunate in having Ian Crowe on our board, and as part of that board representing this community. More work to do, but there is significant population in the other area. Apologies, I'm talking too much. Next slide, please. I'm getting towards the end. So next steps, develop a public-facing version of the plan, focusing on the key deliverables pertinent to the Rutland place. So those last 3 slides, I think, are some of those key deliverables for us. We'd obviously want views about those because you'll have, when you get the slide pack, you'll see all of the actions there. But we do need a public-facing version because there's obviously the public need to understand what does it mean for me in terms of those actions. We need to continue to translate the plans into measurable actions with baselines. So some of these are new that we've started. So there's a lot of work for us to do on that. And that's across LLR for all of the actions, but again, specifically targeted for certain actions to Rutland residents. Linked to the health and wellbeing strategy and delivery plan. They're not separate. It's an iteration and part of the health and wellbeing strategy, and it links to the 5-year forward view. So we need to make sure that they are running together and not off in separate directions. And I mentioned earlier, we need some further focused work in a few areas, particularly children's, women's services, and some others. And that's it. That's me. Then sorry.
Well, thank you very much, Debs. Okay, I'm going to open this up for questions and discussion. Would anyone like to start? I knew you, Jen, I just knew you would then.
Thanks, Deborah. It's very ambitious and I wish you all the success with it all. I just want to raise a comment or query that came up at our Health Watch annual meeting last week. And it was we're told that we've got to sort of think pharmacy first, and that the pharmacists are going to be, sort of prescribing and that sort of thing. And I had a lady stand up and say, yeah, it's okay, say pharmacy first. I couldn't get a GP appointment. So I went to the local pharmacist. I needed antibiotics because it was a chest infection and I had to pay £45. So what I'm sort of thinking is, could the public be better informed about which pharmacies they can actually go to now and for what services, and be kept abreast of developments as they go forward, so that they know that if they go to the pharmacist and say they're not very well, they're not going to be slapped with a bill of £45 upwards. I thought it was a very valid comment.
Yeah, thank you, Chair, and thank you, Janet. Absolutely, we need to make a public which pharmacies are available. You've given a specific example of an individual. I'd need to have more information as to what that involves. Obviously, some of the public do pay for prescriptions, whether it's prescribed by the GP or whether it's delivered direct for the pharmacy. So in terms of that individual case, I need to know a bit more information. But we do, a part of our overall campaign of improving access to primary care will link to better communication about the services that are available. So when I mentioned about us reviewing same-day urgent care, pharmacies that community pharmacy service is part of that process.
The lady was in her 80s, she did say, so she was entitled to free prescriptions.
I'm happy to look into that if you want to provide details, obviously outside of the board.
I don't know her name, but it was very. Do you know the lady? Yes, it was powerful, wasn't it?
Right. And I think that we could carry that up outside of the meeting and see if we can sort that one out. Thank you, Jenna. Thank you, Debs. Any other questions? Yeah, thank you, Kim.
Thanks, Deb. That was really, really thorough and really interesting. And I think it will help clear up a lot of questions that I know I've received from the community in Rutland about, so what does it mean? So what the 5-year forward plan is, it was great, but then what does it mean for Rutland? And I think here we've got some very clear, there's a lot of information, but then there's a lot of work being done. And there's a number of areas, as you said, 9 to cover. So I suppose the question around is, how do we let the public know what we're doing? Because I think one of the things was last time, July 2022, which I'm presuming this supersedes that then, or does that stay in place? So that's 2 questions, that, but also then how do we get this out to the public and let them know what's happening and how you're reviewing it?
Thank you. Yeah. You'll note that I'm put on the further actions about translating what specifically on is in the plan that's pertinent to the Rutland population. So we could have a full action plan which is available for the public to see, which covers every single item in there. And actually that wasn't all of the things that are going on in health. It will be lost. People will find it difficult to read, and I don't think it would be the most useful. So we do need to do a piece of work of confirming those hexagonal slides, were they hexagonal? Can't remember, about what's local, what's pertinent to the Rutland population, and then pulling out some of those and making it in a user-friendly term. Now that's going to take us a couple of months to do. I just need, and obviously we need to link with the team and others, and I would welcome feedback, obviously from colleagues from the Health and Wellbeing Board, about which of the specific actions that you feel are pertinent, and was my assessment right? Because there might be some things that you want to pull through. Does that answer your question?
Thank you very much.
It does. Thank you, Deb.
Thanks, Deb.
Thank you, David.
Thank you. A useful summary. You touched on a little bit around learning disability and autism. I just thought it's an opportunity to share potentially with the board the LLR annual learning from deaths reviews. So everybody has learning disability and autism has just been published and reviewed back. And you have a life expectancy across the whole of LLR, which is something in the region of 20 to 23 years less for somebody who's got a learning disability or autism than somebody who lives in the same street, same age, same population. And I just wondered that might be something to bring back to a health and wellbeing board, that the kind of key learnings over how do we help and make a difference are actually about doing the basics of care. It's not all NHS care, it's care in its broad sense, whether that's families, accommodation providers, social working, the NHS, care homes, and so on. And it's just a useful reminder to say, actually, if we get the basics right, it makes a huge difference to everybody's well-being. So it might be a chance to say in the next Health and Wellbeing Board, we'll bring that back for a 5-minute look at and a review. Okay.
Thank you, David. I think that's worth recording and putting onto, as a future agenda item. Thank you. Councillor Smith?
Yes, as someone who's new to this, first of all, I have to say I'm very impressed with the work that's been done. I did read through all the papers, and obviously a great deal of work has gone into it. I just wondered whether the aim of the board is to focus on the big returns, as it were, that will give the best health returns. I'm thinking particularly of nutrition. I mean, throughout ages, nutrition has been all important. And if you look at the graphs from the 1920s, as nutrition improved, so health improved. Unfortunately, I think we're going backwards now because nutrition is, I think, causing problems, overnutrition, as it were, and it will lead to huge problems in the future with diabetes, etc.
Thank you, Councillor. Really, really good point. And there are some actions in the plan relating to obesity and diabetes. I think nutrition is more than a health issue. I think it's something that we need to pick up across health, social care, council, local. So certainly it's something that we can look associated with our health and wellbeing hubs. But there are some actions in the plan that are there. We certainly need to start picking up at education in schools and start early on, because I think that some of the habits built up in schools, and it links to some of I'm going to say it because I'm surprised I've not been asked, some of the oral health issues associated locally, and there's work to do on that as well. So thank you.
Thank you very much, Deb. Thank you, Councillor Smith. I think we'll just take on board Deb's request. Can we read through this one? Sorry, I apologise. Are there any other comments or questions before I move on? Sorry. Thank you, Sarah.
I just want to say thank you to Deb and team for pulling it together, because I think that was a really comprehensive run through of where we are, and it links really closely to the 5-year plan. So thank you.
Thank you, Sarah. Sorry. Anybody else before I? No. Okay. Yeah, just reiterate, can we get when it comes to the pack, please read through it, please comment, send all the comments back to Deb so that she can then work on them. And do you have a time frame? I always like giving people time frames when you'd like them back.
Just in the next couple of months, really. It'll take some time to work through. You might have some questions about, I don't really understand what that means, and it'll take us some time to work through them. Some of the areas in the plan are just in this first stages of development, so that might be the stage we are. Some are a bit more advanced, and I suppose I'd like to echo Sarah's comments, because actually that there are a team of people across all organisations, not just the ICB, all health organisations, UHL, LPT, primary care, and quite a lot of Sarah's team actually have had a great involvement, and my team in delivering this health plan. It'll only mean something if we can work together around the local population. And a lot of these areas in the plan are very ambitious, and but if we don't aim high, then we're not going to move forward far enough. So thank you.
Thank you. I'd like to reiterate Deb's comments there. I think it's been a very hard work and but ongoing. Right, if we could move on. The next is the point 9. It's the Joint Strategic Needs Assessment updates and timeline. I'm going to give Adrian 15 minutes, Adrian, to discuss this Over to you, Adrian.
Thanks, Chair. We won't need 15 minutes. It's just a very brief update. There is a JSNA plan that's been circulated previously. The JSNA chapters that have been published so far is the oral health, HNA, the pharmaceutical needs assessment has been published, the health inequalities chapter, end of life JSNA, and preparing for population growth. The next chapters that were on the list were substance misuse and alcohol misuse, which were separate, but we've combined them now. They were supposed to come to this board meeting, but the timeline has slipped on that because we want to go back to the working groups that supported pulling those chapters together with some comments, just so that they can finalise that chapter before it comes back to board. So that's been postponed now until January. So both of those will come to the January board. The Rutland military and veteran health needs assessment work is still down for autumn and winter. Quite a bit of that work has already happened around the rotation, and as they're alluded to, there's been quite a bit of work around those officers who were coming back to the barracks from Cyprus, and we've got a lot of census data now for those veterans that are already there. So that will come in the winter. We'll know a bit more about that date over the coming weeks. And left on the plan is mental health. So that's currently being scoped as part of the next chapter. There's a number of people involved in that. Learning disabilities as well, and we're looking at potentially where there's some crossover between those two chapters so that we can bring some of that together. So the likelihood is that they'll run consecutively side by side. There is a SEND piece of work on the agenda. I don't have any more information on that at the moment. That is likely to come out after the learning disabilities chapter. And then the others are aligned with almost phase 2 and phase 3 of the plan, which rolls into 2024-25, which is best start in life, staying healthy and independent, healthy aging, and equitable access to services. There is a COVID recovery chapter on the plan, but I think we're probably questioning the relevance of that now. So we've pushed it back to the end. That's likely to come off, but we've left it there for now. And there is some wider work around military and veteran population across LLR, which is happening with ICB colleagues. Again, that's been pushed back to the back of the plan whilst we work out what more we need from that piece of work after the Rutland specific work is done. So that's the plan. We can publish it with the minutes. I'll send it to colleagues from Democratic Services. The next chapters to come are substance misuse and alcohol misuse, which will be in January. Thanks, Chair.
Thank you, Adrian. Do you have all the information and help that you need from members of the board here? Are there any other help that we can give you?
Not at this time, no. Thank you, Chair.
Thank you. Right, moving on to number 10. Got that bit. Are there any questions about what Adrian's just described to us? I always forget that bit, sorry. Okay, thank you. So moving on to number 10, the Joint Health and Wellbeing Strategy Update. We received report number 148-2023 from Catherine Wilson, which gives an update of the progress of the Joint Health and Wellbeing Strategy Delivery Plan and highlights elements of the Rutland Outcomes Report. So, Catherine, is there anything you'd like to add to that report that we've received?
No, thank you. Unless there's any questions, of course.
Yes. Are there any questions? I presume you've already. Are there any questions about that? No, nothing. Okay, so If there are no questions, I'd like to draw this discussion to a close, or this section to a close. And the motion is that the board notes the further development of the JHWS delivery plan and notes the latest Rutland outcomes report. All those in favour, please raise your hands. And those against? Any abstentions? No, thank you. So resolved. The board has noted the further development of the JHWS delivery plan, noted the latest Rutland outcomes report, and that's it. Thank you. So moving on to 10A. We've also received the report number 1502023 from Catherine regarding the final version of the Health and Wellbeing Communication and Engagement Strategy. Catherine, over to you.
Thank you. So hoping for agreement for finalising this plan, took on board the recommendation from the last meeting that we needed to include Children's and Family Service. So we've done that piece of work now, and we've had just some additions to the delivery plan element of the comms and engagement plan, and we now have representative from children and families on the working group going forwards. So I'm hoping that we can agree to finalise the plan based on that.
Thank you, Catherine. Any questions? Thank you, Janet.
Yeah, it's been brought quite a lot to our attention that a lot of the documents that are put in the public domain are not easy read. And as this is a communications and engagement strategy, I'm just wondering if it'd be possible to have an easy read version.
Catherine, do you have a view on that?
We have, yeah, that's the aim of, we did a summary document. I don't know if I've got it here with me. That was the aim of the 3-page plan summary document that I brought a couple of meetings ago. So that is in place, but absolutely that was in response to having something more reader friendly. So that is in place.
Are you able to find that, Janet, and review it?
Could you send it to me, Catherine?
Yes.
Yeah, thank you. And I'll have a look at it.
Thank you very much, Janet. Thank you, Catherine. Are there any other questions to Catherine? No? Okay. If that's all there is, I'd like to draw this discussion to a close. The motion that the board notes the content of the report and notes the finalisation of the Health and Wellbeing Communication and Engagement Plan following input from stakeholders, including representation now from Children's Services. Thank you. All those in favour, please raise your hands. Anyone against? Any abstentions? No. Thank you. So resolved that the board has noted the content of the report, noted the finalisation of the Health and Wellbeing Communication and Engagement Plan following input from stakeholders, including representation from Children's Services. Thank you very much. Moving on to section B, we have also received report number 1512023 from Councillor Tim Smith, portfolio holder for Children's Services, and Dawn Godfrey, Strategic Director of Children and Families, regarding the recent area SEND inspection report. Councillor Smith, is there anything you'd like to say in addition regarding the report?
No, this reflects very well on the department run by Dawn and the social workers all involved in SEND. I mean, you read the report. It is really very good. It's one of 4 in the country, I believe, Dawn. That
Might have gone up to 5.
Oh, 5. Oh dear. That received this accolade. Yes, they did point out one or two areas where improvements could be made. I'm told that these are already in place. I think from memory, they're neurodegenerative pathways and mental health services, better use of data, the services children could be better served. And have I left any out there? I'm not sure I have. Yeah, okay, yeah, okay. But yes, I mean, it's a very good report.
Lovely, thank you, Councillor Smith. Dawn, would you like to add some extras, please?
Thank you, Councillor Anderson. Yeah, just to add to that, so there was only 3 areas of for improvement, all 3 of which are already being are included in our refreshed strategic plan. And there's a clear link with we're also part of the National Change Programme for SEND and alternative provision, and leading on behalf of the East Midlands alongside Leicester City and Leicestershire. So the areas for improvement that were highlighted within the inspection actually fit really nicely into the National Change Programme that we're leading on. So there's a nice synergy there, and gives us a really brilliant opportunity to just continue to develop and deliver really good services for children with SEND across health and social care.
Thank you, Dawn. I think you and your team should be commended for the fantastic work that's gone on there. So well done. Are there any comments, questions? Sarah.
So can I just ask then, Deb, are the health actions that are needed to deliver that in our plan?
They are in the local area plan as opposed to the LLR plan, because
You might just want to cross-reference that then. So don't repeat it, but cross-reference it to the LLR plan.
yeah, because the inspection is an area sender inspection,
Yeah.
so it's place-based.
That's fine. As long as we're capturing the actions, I think it's important from our perspective, given that a number of the actions were health related, weren't they? That we capture them somewhere within our plan, even if it's to point them to another plan. I know that's bizarre, but I think we should.
Oh, sorry, Kim.
Yeah,
Thank you.
that's a good point, Sarah. Actually, I went over that side quite quickly because I talked too much. So some of them are in the action plan. We just need to check that they all are. Thanks.
Thank you, Kim. David, if you'd like to.
Thank you. I mean, it's funny reading those reports because there's some really, really positive stuff in there about vision, ambition, and then some of it you need to translate to remember that there's extreme praise in there. It's just the way they describe it. Things like typically lead to positive experiences. That is praise indeed compared to when you read other reports, and it's kind of getting used to understanding that. But I thought it's worth, if we think about the long-term changes we want to make for the population of Rutland, then making sure and supporting young people with special educational needs and disabilities is going to make a long-term change. Because if young people are getting the support they need, they will be better equipped for adults, be more independent, more able to contribute to community, and so on. And that has a huge, great impact on their quality of life, but also has a huge, great impact on the health and care systems going forward. So it's a really important area that we continue to look and support and take forward.
And presumably impact on their life expectancy.
Absolutely. Yeah, completely.
Any other comments, questions from that? Okay, so where are we? So we've looked at it, we've discussed it. Let me just get that on my own. So the communication and I've lost it. Here we go. Sorry. Okay, thank you. So to have help from my left arm person. So any other discussion, bring this discussion to a close. The motion is that the board notes the area SEND inspection outcomes and the delivering better value programme progress. And all those in favour, please raise your hands. Anyone against? No. Any abstentions? No. So it's been resolved that the board has noted the area SEND inspection outcome and the delivering better value programmes progress. Thank you. Moving on to point C, Rutland Mental Health Neighbourhood Strategy and Action Plan. This is a report number 1494023 from Mark Young and Emma Jane Hollands on the Rutland Mental Health Neighbourhood Strategy for 2023 to 2027 and the related action plan. Emma Jane, I believe, is online, hopefully. So if we'd like Emma Jane to join us and to add anything to this, please. Thank you.
Hi, Emma Jane, can you hear us?
Very much, and good afternoon, everybody. I've been watching with intent as we've been going through the meeting. So hopefully you can all hear me. Jane's running around.
I think you're not very loud, Emma Jane, so we might just be fiddling with the technology here. Can you talk again, please, Emma Jane?
Yes, is that better?
Much better.
Does that work? Fantastic.
Please start.
Okay. Super. So the reason I'm here this afternoon, obviously, the mental health strategy and action plan is in the notes for you, and one of the reasons we're asking for approval from the Health and Wellbeing Board is the Mental Health Neighbourhood Strategy Group are a subgroup of the Health and Wellbeing Board, and so it's important that we have that synergy with yourselves. The strategy that's in front of you is very much taking a preventative approach, addressing those wider factors which influence mental well-being, as well as ensuring that we've got those responsive, high quality services and support available. And as we've highlighted in the health presentation that Deborah did earlier, as local to home, being in the right care at the right place. And that's what the strategy is hoping to address. We've also got there an action plan which is very high level. As Deborah said, we didn't want to put absolutely every action in that action plan because it is a summary of the sort of areas of work that we will be involved with. We don't want it to get lost, and it is a public domain document so you can see what we're doing. But to give you sort of a highlight of some of the things that are happening as a result of the work that the neighbourhood team and group have been doing, such as since the start of August, we've been meeting weekly on an MDT approach to discuss and target selected people who are referred through our Joy platform to provide mental health support. We have the GP mental health lead, we have our own RISE mental health care manager, we have the mental health practitioner from LPT and mental health facilitator, we have the local authority mental health social worker, our clinical psychologist specialising in personality difficulties from LPT, supported and facilitated by our senior mental health neighbourhood lead, to actually have a joined up discussion to make sure that the right support is given to people highlighted in those weekly sessions. We also are part of the 3 Conversations Innovator site, and we're 10 weeks into that. We've got a new reablement worker in Rutland who is looking at a different way of actually approaching taking support to people where they actually meet, such as if they're meeting at Pepper's or a local cafe, for example, to actually start conversations with people and identify those vulnerable out there in the community for us. Pepper's very successfully had the grant agreed to become our first mental health neighbourhood cafe, opening at the weekends, previously known as crisis cafes, to actually make sure that there is support throughout the week, not just in office hours. And as Deborah said earlier, we are celebrating today and highlighting World Mental Health Day. And the reason that Marcus is not with me today is because he's joining in with Pepper's Citizen Advice P3 Root and Branch Out, actually on the High Street, to engage with our public out there in the community, to raise the awareness of what is out there and to bring that to a fore. We've also recently engaged with the Vita Health Group, and we have the new mobile talking therapies bus actually booked to park on Todd's Piece in Uppingham this Friday the 13th, so that we can actually start to bring our services out there into the community. We supported Age UK through Getting Help in Neighbourhood Fund to relaunch their befriending project this year. And we've got a new befriending coordinator, hopefully that will start in October and get that support up and running again. And recently we had the Kendrew Barracks engagement event, and our RISE team were part of that event, giving the team an opportunity to engage not just with the current serving armed forces personnel, but their families as well. And we made some really good connections with that team. So what you have in your pack is the strategy that brings all of this together to present to you for approval, for continuation and more of what I'm talking about to be done over the next 5 years during the lifetime of the Health and Wellbeing Board strategy as well. Thank you, Chair.
Thank you very much, Emma Jane. Nice and succinct, to the point, and has left us what are there any comments or discussion points?
Thank you, Emma Jane. I would just like to tell you of my own experience with a lady in the village that I live in. She lost her husband of 63 years in February. She had tremendous support in those early months from family and close friends, etc. And then over the summer months, I noticed that she was going into a steady decline. She'd lost her confidence to go out. She said she was feeling giddy. She'd got vague pains here, there and everywhere. And I gave her a RISE leaflet, and one of her daughters arranged for somebody from the RISE team to come out and talk to her. She asked me to sit with her while the lady called Carla from RISE came out, and she was fantastic with this lady, absolutely superb. She, at no point did she take control. She kept making suggestions, and the lady said, yeah, either yes or no. And several things were actioned. And over the period of probably a month, I saw this lady going from absolute total despair, I'm giving up, I'm not going out, I'm just waiting to die, to I'm going to live again. And it was so miraculous. She became a new woman because of the RISE team and this Carla, etc. And I just think it's important that people hear the good stories as well as the bad. So thank you.
Thank you, Janet. I think Emma Jane, you can pass that on to Carla, and a good example of how it works well.
Absolutely. Thank you very much for highlighting that, Janet. And I'd like to highlight something very similar. We have, through the anticipatory care pilot, been looking at sending things out on outreach to the community. And we held a specific event in Barradon recently, where we were identifying people with might have memory or cognition issues. And we had a similar situation. A lady appeared, hadn't been to the GP, was very scared, didn't know where to turn, didn't know what to do. And she stayed at the event for 2 hours, and at the end of that event, felt very much the same as the lady that you're describing. We were able to reach out to her, somebody that just didn't know where to turn, and that's very much at the heart of both the RISE team and this mental health strategy.
Thank you very much, Emma Jane. I'd like to pass on to Kim now, please.
Thank you, Emma Jane. Really good presentation, and just shows that the value of that partnership working as well, and at place level, and the good work that can come from it. So well done to all involved. The action plan, I think you said it's work in progress. Yeah. So, and I think it's just there's some gaps there around the kind of timeframes and ongoing that, again, bit of a stuck record here that the public will pick up on. So what is happening and when it's happening, because it's then able to display all this good work that they're clearly doing in this area. Thank you.
Thank you, Kim. No comment, Emma Jane. Pass on to Councillor Smith now, please.
Well, thank you for the presentation, Emma Jane, and it's good to hear that there are initiatives taking place which are producing results. I just noticed in the strategic priorities that where are we? Yes, 713, increasing local resource to respond to children's and young people's mental health needs. Interested for two reasons. One is, being the children's services portfolio holder, I want to see that mental health services improve there. But actually, for another reason, going back over 30 years when I was a GP, children's mental health services was a Cinderella service in those days, and there still is. I was recently at a Leicester City Rutland Street Safeguarding Partnership, and when CAMS gave a presentation, still there were significant problems in accessing these services. So it'd be good to know whether in future that things are improving.
Yes, thank you, Councillor Smith, and certainly this is an all-age strategy. So children and young people are very much at the heart of the strategy, and the action points within it are part of the action points of the Health and Wellbeing Board strategy as well. So it is an area that we are aware that there are difficulties in accessing services, and we are working with our colleagues both in CAMS, LPT and LLR through the Mental Health Collaborative for LLR to look at where the gaps are and what we can do to support that to be easier for people. But that is definitely an action point within the strategy we will need to look at.
Thank you very much, Emma Jane. And turning to Deborah now.
Thank you, Chair. Thank you, Emma Jane. Good paper, and I didn't touch on some of the health plans because I knew this was on the agenda. I just want to make a point really for the board. So we've got 3 responsibilities as a Health and Wellbeing Board: integration, delivering services at place, and joint commissioning. And the work that's been done on mental health, a part of this development of this subgroup and strategy in the work, is a really good demonstration of how we'll fulfill 2 of those 3 areas. It just opens up an opportunity for us to start to look at the 3rd, which is the joint commissioning opportunities as we go forward. So yeah, just want to recognise the excellent work that's happened in this area.
Thanks, Deborah.
Thank
and
you,
very much,
Deborah.
The slide you had on mental health in the health plan very much is in a synergy with this strategy. The points in both of them are very similar, and the actions, are identical. So it is about integration, and it is about that joined up approach across health, social care, and our communities as well, and all of the voluntary sector and the groups that exist within them.
Thank you very much, Emma Jane. Janet.
Yeah, I've received today, because it's World Mental Health Day, a note from, an email from Health Watch England, and they've did 931 pieces of feedback in September, and the 3 following issues were the main themes that they heard about: delays to care, impact on wider family, and limited choice of support. So
I think we should note them, and I think Emma Jane probably will have heard about them or be aware of those. Thank you very much, Janet.
Thank you, Janet.
Okay, any other comments, questions, observations they'd like to bring? Okay, so we'll now draw this discussion to a close. The motion that the board approves the Rutland Neighbourhood Mental Health Strategy 2023 to 2027 and the Rutland Neighbourhood Mental Health Action Plan 2023 to 2027. All those in favour, please raise your hand. Anyone against? Any abstentions? The item is then, the board has approved the Rutland Neighbourhood Mental Health Strategy 2023 to 2027 and Rutland Neighbourhood Mental Health Action Plan 2023 to 2027 for the Rutland Mental Health Neighbourhood Group. And they were, as you know, attached in the appendix for you to have read. Thank you. Thank you very much, Emma Jane.
Thank you. Thank you.
Moving on to item 11, the Better Care Fund 2023 to 2025. Report number 1462023 from Catherine Woodison regarding the Better Care Fund programme plan and the progress of the Rutland Better Care Fund Partnership Board. Catherine, anything you'd like to add?
Only to say that we heard, just after I'd written the report, that the BCF plans have gone through assurance at national level. So we've got that agreement as well.
Well done. I think that took a bit of work. Are there any comments or questions on the BCF plan? We've all read it? No comments or questions. Okay, so I'd like to support the motion is that the board notes the content of the report and notes the Rutland 2023-25 Better Care Fund Plan, submission of which to the BCF national team was on the 28th of June, and the response has been received, was signed off by myself as chair of the Health and Wellbeing Board. All those in favour, please raise your hand. Anyone against? Any abstentions? So resolved. The board has noted the content of the report and noted the Rutland 2023-25 Better Care Fund Plan, submission of which was on the 28th of June 23, signed off by the chair of the Health and Wellbeing Board. Okay, moving on to item 12, Rutland Health and Wellbeing Board Terms of Reference Annual Update. Right, we now have a review of the board's terms of reference to see if they need updating or amending. We've had a couple of comments already, and we've had one that I would like to make is to propose is that the Mental Health Neighbourhood Group and the Staying Healthy Partnership should be listed as permanent subgroups of the board under section 5. And I think that's that one there. Does anyone else have any comments or amendments they'd like to make to the terms of reference?
Hello, thank you. And this is remiss of me because I should have picked it up earlier. The Health and Wellbeing Board previously had the clinical place lead as a member of the board, and when we changed, and actually was the deputy chair of the Health and Wellbeing Board, when we changed roles, we had a gap in sort of post holders, and Dr. Freya Patino is actually in the audience today, and I would like to propose that the clinical place lead for the ICB is incorporated as a member of the board, please.
Does anyone have any comments or observations about that proposal? Are we happy to accept that? All those in agreement? Anyone disagreeing? Abstaining? Welcome. I had one other comment. I'm not going to tell you who made the comment, however, it was made recently, and it's about the emphasis of the word health and the interpretation of the word health on the terms of reference and whether health is it was interpreted as NHS treatment rather than health. Now, I can't think of a better word than health to describe what we've been talking about and what our main function is. But I just wanted to share that with you. It was recommended that we change that word, but nothing was offered. Nothing was, sorry, that was just sorry. Nothing was offered to fill the gap. But I thought, yeah, it's worth sharing because it may cause confusion. And that's where it stems from. Okay, I've got 3 of you at the moment. I've got Debs. Okay, and Sarah and Catherine. Thank you. Thank you. So we'll start with Debs, please.
Yes. Thank you, Chair. So for me, health is broader than health care, and part of our I think the success of the Rutland Health and Wellbeing Board is that we cover the whole aspects of both health and well-being, and health means good health as not just healthcare and treatment. So I personally would be supportive of keeping the word health in our terms of reference, because it would be, I think, remiss of us if we moved over our focus just on treatment in terms of health as opposed to overall health and well-being. Thanks.
Thank you for that, Debs. I would probably agree. Sarah.
So I was going to say the same thing as Deb, but we could explain what we mean by health as a footnote to the terms of reference, i.e. it's wider than healthcare and it incorporates X,
That
Y,
would
Z.
be a way of resolving it. Just to, it's completely I'll put you at the end, don't worry. Catherine, if you'd like to just end.
Yeah, I think that's useful to explain what we mean by health.
Yeah.
Health and Wellbeing Boards are obviously under the Social Care Act 2012, so we can't change the Health and Wellbeing Board. That's what our name is, and all the functions underneath it. So we have to keep the name Health and Wellbeing Board, but absolutely we can explain what we mean by health more clearly.
Very
That
pragmatic response. Thank you. Ian.
Having worked in public health for 20 years, I always fall back on the definition provided by the World Health Organization, which is health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity.
So we could actually put that in as well. Yeah, let's go for the absolute correct definition then. Kim, if you'd like to.
I just want to reiterate, it is part of legislation that we're working to and government guidelines. So it's not for change room, but it might be for clarification. So I think that's been useful.
Yeah, I think that's a very sensible comment. Thank you for that. Anybody else like to add anything else to that section? Or anything else about our terms of reference? Anybody, are we happy with Debs, if you'd like to
So I
add?
was just going to say we didn't vote on your proposal.
I'm going
Oh,
to. And
Sorry, Chair. Yeah, I've just spotted as well in our membership, we have listed the clinical commissioning groups, which of course no longer exist. So those need updating, which. Yeah. Should it be? Thank you.
Yeah, exactly. Let's just, are we all happy with that? And we've got the membership now to be amended, the change from the CCG to the ICB, and nothing else we think needs changing. So are we happy to accept that as our new terms of, or our amended terms of reference? And all those in favour, please raise your hands. Anyone against? Any abstentions? No, resolved. The board has approved the terms of reference of the Rutland Health and Wellbeing Board, subject to requested amendments being made. Number 13, the review of the forward plan and annual work plan. So if you've noted it, I'd like to ask you if there are any items that you would like to propose for inclusion onto the board's work plan. And
So we touched on putting the leader report. It's LEDER, which is learning from deaths reviews.
the one you've just been talking
Yep.
about, thank you.
Yep.
When would that be?
I think next meeting's January.
is.
I'd be advised by you if there's space on the agenda, we could feed it into January. That would be fine, whichever works.
Sorry, we currently have an update from Falls data from Catherine. We have the Armed Forces Covenant Duty and Health Inequalities from Karen Kibblewhite, the 2 chapters from Adrian, as mentioned, and the Rutland Proactive Care Dementia Pilot. So if we add the lead, that will be a pretty full agenda.
I think we'll squeeze you in quite easily. Thank you. Thank you very much for that. Yes. Sorry, Dawn.
No.
Other agenda items come on, or to take your advice, Chair, about whether the Health and Wellbeing Board find it useful, but I referenced that we're part of the change programme for SEND and alternative provision, but part of that includes LSEC, which is Early Language Support Pathfinder for Children. It doesn't stand for that, but it is early language support, so it's not just a local authority LLR change programme, it's absolutely in partnership with our health colleagues. So it might be useful for the April board to bring an update on the progress of that. And it's a really exciting kind of opportunity as well. So,
And I think for information, so that we are, at least we know what's happening. I
Yeah.
think that's rather than, it's not ours to manage, it's for you to inform.
yes, but it will link also into the 5-year forward plan as well. So there's a link there.
Yeah, Chair, it's in the action plan on the children's slide. So yes, that's fine.
So, Councillor Smith, would you like to ask a
I
question?
think I found the answer to my question. This is a very naive question, being new to this board. Yes, I just noticed that some were crossed out: substance misuse and alcohol misuse, but it is on further on down. But obviously, these are important items, so they will be included in future discussions.
Yes, and those are the JSNA chapters that should have come to the meeting today, but have been pushed back to January because of the working groups. Yeah.
And another thing that has been crossed out was the winter preparedness. And I can't say that word. And we have had discussions about that. It is covered and has been covered in other meetings elsewhere. And the information has already gone out. So there's probably no need to update anybody because that's gone. The only other things, do we need to mention the COVID bus? Look at his face. Maybe we don't. The vaccination bus.
We could encourage everybody to access their vaccinations. COVID along with flu make a really big difference for winter.
In addition to that, to the winter preparedness. Sorry, Adrian, put you on the spot then.
No, I was just going to say that there is a access to vaccinations is via the bus rather than via GP in Rutland, and I'll look to Mitch to see where the list is, but the list presumably can be accessed.
Yeah, so we've started delivering through the vaccination bus to some of the town, well, to Oakham and Uppingham. We will also be going to the villages, which will be communicated imminently, right via the council, and all information is on the website as well, which there'll be a link for in the press release. So, yeah.
Thank you very much, and thank you for the information you provided earlier this week. There has been just to feed back to you. There's been 2 issues that I've been informed about. One was the very long queues, and the other was the access for disabled. The steps aren't easy, and so that was something that we'd like you to know about, and put a lift in, do something. But it is an issue. But yeah, there's obviously demand for it out there. I think that's all I have to say. So is there any other urgent business from anybody? No? Ooh. And nothing that has come to me, I don't think, apart from the last 2 items. So the date of the next meeting, 16th of January 2024 at 2 p.m. here in the council chamber at Rutland County Council. And unless there's any comments, observations, I would like to declare this meeting closed at 3:31. Thank you, everybody.